Hello, everyone. I'm Rosalind Carpenter, Chief Diversity Officer for Common Spirit Health. Thank you so much for joining us for the Center for African American Health Black Health Summit. Today's session will focus on the effective use of community partnerships to support mitigating the impact of COVID in Black and Brown communities. We will have a wonderful conversation about COVID-19 resiliency, building support for vaccine trust through community partnerships, and the importance of building trust through our leaders, clinicians, and community organizations rooted deeply in our communities. Building community trust is essential in improving participation in COVID testing, contact tracing, getting the COVID vaccine, and doubling down on wearing masks, staying with the practice of washing our hands more than usual, socially distancing, and limiting your contact with people outside of your immediate circumstances. I'm intentional here to say our circumstances because everyone cannot stay constantly in their homes. Our vulnerable populations teach school, work on the front line in healthcare, our first responders, work in grocery stores, retail, use public transportation, and have kids who participate in sports. So just wanted to make sure that you know when we say community, we're referencing community of color who has in many cases expanded exposure of COVID-19. To build a community of trust, clinicians, public health officials, researchers, and trusted community and religious leaders must be a part of the conversations and actions being taken to encourage participation in our Black and Brown communities made vulnerable by COVID-19. We have an amazing panel of guests who will speak on COVID information you need to know, effective use of community partnerships for reaching communities of color, and about the need and impact of building trust in following the science to prevent deaths and severe illnesses as a result of COVID. You will hear from our panelists in this order. We will hear from Morehouse School of Medicine's National COVID Resiliency Network, Centaur Health, Denver, Colorado chapter, the Links Incorporated, and Shorter Community AME Church. Common Spirit Health is a proud sponsor of the Black Health Summit, and for a number of years, a sponsor of the Center for African American Health. We are deeply committed to working in communities we serve and with community partners to support communities of color and vulnerable populations. And we value partnerships because we can't do this work without you. Common Spirit Health is a faith-based nonprofit Catholic health system dedicated to advancing health for all people. We were created in February of 2019 through a merger of Catholic Health Initiatives and Dignity Health. We have a national office here in Denver, Colorado, with our corporate headquarters in Chicago, Illinois. Centaur is our affiliation in Colorado and Kansas. With a team of over 150,000 employees, 25,000 physicians and advanced practice clinicians, Common Spirit Health operates 140 hospitals and more than 1,000 care sites across 21 states. In fiscal year 2020, Common Spirit Health had revenues of $29.6 billion and provided $4.6 billion in charity care, community benefit, and unreimbursed government programs. The coronavirus pandemic has illuminated for us devastating disparities in Brown and Black and vulnerable communities. The existing healthcare system is not working and is leaving millions of people unhealthy due to socioeconomic factors beyond their control. Clearly, we have a broken health system, and we as providers have too few resources to improve the health of our communities. We want to see our healthcare system solve health problems and achieve health equity. Common Spirit is providing healthcare from coast to coast in communities large and small. We provide services across the entire care continuum, from acute care, clinical specialties, primary care clinics, pharmacies, home health care, virtual care, and community health programs. This is how we believe our organization can help create a better and more just health system. We believe everyone has the right to be healthy. Our Common Spirit Health vision for a more just health system believes that to achieve health equity, we must rethink 4 areas of healthcare. 1, care delivery. A more just health system will bring care to our patients instead of waiting for them to seek care when they're sick, through a new delivery system like telehealth. It will create new kinds of access points and deepen partnerships to address health and social needs. 2, universal coverage. Every person should have access to quality health coverage that helps them stay physically, socially, and mentally healthy. We can achieve this through Medicaid expansion, coverage for mental health care, and coverage for programs that connect underserved patients to social services that impact their health, including housing, nutrition, that's access to food, and employment, that's jobs. 3, social determinants of health. Social justice is at the core of our mission, and we must treat the social causes of poor health with the same urgency and resources that we use to address acute medical needs. We must reduce health disparities through targeted health and social programs like scaling of our community health model, which connects patients to a deep network of local health and social services. And 4, our healthcare workforce. It is critical to develop a healthcare workforce that can meet the health and social needs of future generations, and that reflects and includes the communities we serve. The healthcare workforce of the future must be trained for new technologies, be committed to community health, and reflect the diversity of the patients we serve, which is why Common Spirit Health has entered into a partnership with Morehouse School of Medicine. In response to the dual pandemic of COVID-19 and racial injustice, we've committed to a 10-year, $100 million partnership to develop and train Black physicians and help to address the underlying causes of health disparities. Our collaboration will include addressing cultural competence and developing research programs to impact illnesses that disproportionately affect minority and underserved communities. Our Morehouse School of Medicine partnership includes actively working with the NCRN, the National COVID Resiliency Network. Featured as our first panelist is Brittany Bethea from the Morehouse School of Medicine. Brittany, please share with us more about NCRN, how and why community partnerships are important to mitigate the impact of COVID-19. Brittany?
Thank you, Rosalind. I'm so excited to be here today. I'm representing Morehouse School of Medicine's National COVID-19 Resiliency Network. I'm Brittany Bethea, and I'm the Director of Communications and Dissemination. And today I'll give you a brief overview of the network's purpose, our institutional mission, as well as ways that you can get involved. So I'll just briefly share my screen. And if everyone could let me know that they can see. So again, I want to give a warm thank you from our Morehouse School of Medicine team, especially from our president, Dr. Valerie Montgomery Rice, as well as our co-directors, Dr. Dominic Mack and Daniel Dawes. I sit on a team of a wide range of subject matter experts in community engagement and strategic marketing and communications, as well as primary health care. At Morehouse School of Medicine, our mission is essentially to improve the health and well-being of individuals and communities. Rosalind spoke to a couple of our other core mission areas, which is really to focus on increasing the diversity of health professionals and the scientific workforce. We do this by first addressing primary health care through programs that really span across education. So for example, our MD program, our MPH program, and then we have doctoral programs in biomedical sciences. We also have research centers and institutes across all of the leading causes of death in primarily minority communities, and engage in community service in the organization's focus areas within Georgia as well as across the nation. Our work often emphasizes people of color and those who live in underserved areas, whether that be in urban or rural populations. And so next, I'd like to give you just a brief video that will show you what we have been doing with the National COVID-19 Resiliency Network to not just address the number of cases and deaths in our communities, but also build strategies for recovery.
Morehouse School of Medicine is one of the 4 HBCU historically Black colleges and university medical schools in the nation. It's the youngest of the four. It was formed in 1975 on the campus of Morehouse College. But we were created to lead the creation and advancement of health equity, working with communities of color, and as well as training students. We're also a research institution. When COVID-19 hit, of course, we provide health care to the community. The patients were at risk, but also we did the studies to show that COVID-19 was impacting Georgia and disproportionately impacting the communities of color, especially the African-American community. We were already suffering in these communities with the high incidence of chronic diseases such as diabetes and hypertension. And then when COVID hit, that was a greater impact on communities who also have less access to care. And therefore, we had this opportunity to apply for this funding with OMH to develop the National COVID-19 Resiliency Network.
And so in line with today's theme of strategic partnerships, that really is the core of our national network. We partner with the Office of Minority Health at the Department of Health and Human Services to essentially coordinate a strategic network of not only community-based organizations, but hospital systems, faith-based organizations, as well as others who play a role in making sure that we keep a pulse on the needs of the community and the strategies that we need to develop in order to address them. Another key tenet of our work in the network is to also develop culturally competent educational materials that specifically speak to COVID-19 testing, vaccine trials, as well as vaccines themselves. And ultimately, what we want people to understand is that even though we're in a cooperative agreement with the federal agency Office of Minority Health, our network is actually governed by community members. And so I'll speak later on our National Advisory Board, as well as our Community Coalition regional boards that many of you would actually be able to participate in to collaborate with other organizations in your state or in your city to ultimately develop strategies for mitigating the negative impact that COVID-19 is having on our communities. Next, I'll just talk briefly about what our program objectives are. This might help you understand why it's important for us to partner with so many different types of organizations. So the first is that we want to identify and engage vulnerable communities. We often know the statistics and the data behind the number of cases, the number of deaths, and the number of hospitalizations. But one key component of this work is actually bringing people from the community to the table as we develop solutions. And so we work with our partner organizations on the ground to ensure that those individuals that they engage in their programs on a day-to-day basis have a of communication with us to share their concerns and their information needs. And when we're developing solutions that we can co-create those with the community. The second objective is really around the partnership development. And so Morehouse School of Medicine, we had a set of partnerships that existed prior to us launching this program. But a key component is actually further developing new partnerships that tap into the areas where there are gaps. And so as Rosalind mentioned, the partnership component is really key to us being able to implement the strategies that we then develop, as well as iterate along the way to ensure that we're having the outcomes of our desire. The third program objective is really about the cultural competency. So we work very closely with the organization's Office of Minority Health at HHS. We work very closely with the NIH at the National Institutes of Health, as well as the CDC. However, some of the messages and materials that have been developed may not have the information in the language of preference for the communities that we serve, or they may not speak to the cultural nuances that we know exist for many of racial and ethnic minority communities. And so what we're doing is we're partnering with our organizations who do understand those nuances to update or adapt federal guidance around COVID-19 testing, vaccine trials, and vaccines. Our next program objective is really centered around leveraging technology to link people to the information that we're developing, as well as ensure that they have a line of care options available to them wherever they live. Lastly, we're monitoring and evaluating the impact of our work, and then ultimately we'll be disseminating our lessons learned, both at Morehouse School of Medicine as well as through our partners on the ground in the community. And so speaking of partners, I'd like to just go through a few slides that demonstrate the strategic approach that we have with having partners both at the local level as well as at the regional and national level. So our core set of partners that really focus on infrastructure for our program related to our website and app development or our message development or even our data strategy for ensuring that we're having decisions that are based on information that we have on the ground and that's real time. We're partnered with KPMG, Salesforce, and Venture Leadership Consulting to really create a digital presence that can get information in the hands of individuals through their phones. And we're partnering with the University of South Florida, their College of Public Health, as well as ICF Next to conduct interviews in the neighborhood, to hold focus groups across the nation, to ensure that we're having conversations with communities that ultimately inform the messages and materials on our resources that we distribute. We're also partnering with Comcast to provide vouchers to low-income families to ensure that they do have access to internet so that they can have a connection to a resource like our network, as well as Alliant Health Solutions, who's really driving our data strategy for how we analyze the number of cases and deaths to understand where our hotspot areas are in the nation. Beyond that, we also have partnerships with community organizations who focus on the particular racial and ethnic groups who are being most disproportionately impacted by the pandemic. These groups cross over African Americans, Latinos, they cover Asian Americans, as well as Native Hawaiians and other Pacific Islanders, as well as American Indians. Common Spirit is one of those primary partners that we have with a health system perspective and connect resources. We're also engaged in partnerships with other colleges and universities, understanding that they have their own relationships that we should be leveraging with communities around ethical engagement of communities in research, such as Tuskegee University. And so our next steps are really, they are centered around the development of our partnerships and the strength of our relationships. Ultimately, what we are trying to do is to build awareness of the National COVID-19 Resiliency Network across the nation so that community members are linked to COVID-19 resources and care options through our website and app. We're also trying to build opportunities to engage with community members and community organizations so that there is a platform for addressing their ongoing questions and their ongoing concerns around COVID-19 prevention measures, testing, vaccine trials, as well as vaccines. And then ultimately, the partnerships are really important for sharing our best and promising practices. So after monitoring and evaluating our efforts with our partners, it's really important that we understand what's working and where there's still opportunities for growth. And so many may ask, well, what does partnerships look like at our network? It's partnerships with patients and community members. It's partnerships with community health workers who are trusted individuals in their communities. It's partnerships with our providers, as well as community-based organizations, including faith-based organizations, as well as local and regional media outlets who our communities trust and find their information. I just wanted to briefly highlight what some of the resources are that are available to communities and community organizations on our website and app. Primarily, we want to make sure that individuals do monitor their symptoms. And so we have an interactive symptom checker where individuals can make sure that if they are demonstrating symptoms of COVID-19, that they're directed towards care options and guidance on next steps. We also have a location-based resource navigator where individuals can come in and place their zip code or their address to find the appropriate resources nearby. This may include testing locations. This may include ultimately where someone can go and get a vaccine when their group is eligible. It may include the closest clinical facility that is nearby, such as a hospital or a qualified health center. It might even include individuals' resources for mental health or for clinical trials if that is of interest to them. We also provide community-based organizations and individuals an understanding of what the risk is in their area. So you can similarly come in and put in your zip code to see how many cases, how many deaths, and how many hospitalizations are occurring at that moment in time in the area that I live in. And then lastly, as I mentioned, it's really key that we continue to partner with organizations to provide educational materials to our communities. And so on this slide, you see that there are materials that we've developed at Morehouse School of Medicine here on the left and on the right around vaccines. But then there are also materials that our community organizational partners have developed. And so this ultimately helps to expand the capacity of not only just Morehouse School of Medicine, but every organization who is a part of the network. Lastly, we have a multilingual call center that is available to anyone to use in the United States to help them either navigate the website in the app or to get access to the resources that are available on those platforms if that person is not able to access them themselves because of technology barriers. Lastly, our partnerships are also really critical to ensuring that we expand and amplify the reach of very valuable community events that are happening virtually. Our website allows for individuals to come in and see what events are being hosted upcoming in that particular week or later in that month, specific to the topics that might be of interest to them. And so ultimately, community engagement is really at the core of our efforts. So beyond our technology, we really have several activities that partner organizations in which other region. We have a report that we have are happening in their particular area and how to tackle them. Again, there are virtual events where partnerships are really critical for sharing subject matter experts and speakers bureaus so that the conversations can continue but not burn out organizations and address the capacity that they may have for hosting events like this. We also have opportunities for organizations to participate in some of our communications research. So learning how to craft messages for particular audiences and also understanding what are the dissemination possibilities for those individuals in vulnerable situations, such as those who don't have access to technology. So I would like to just mention that if you are an organization or an individual who's interested in partnering on a community conversation, that we do welcome that. Again, the purpose of these community conversations are to address the questions and the concerns of communities around testing and vaccine adoption. These are just a few examples of some of those instances where we have partnered with blackdoctor.org, with the National Latino Behavioral Health Association, as well as Unidos. We've also partnered with the Links in the Southeast, as well as the Urban League Georgia chapter. And so if you'd like to learn more about the National COVID-19 Resiliency Network at Morehouse School of Medicine, we do invite you to collaborate with us as a volunteer outreach partner. You can stay up to date with when new resources are available through the network. And we do encourage you to create accounts so that you can have a more tailored experience with saving the different resources that are most relevant to the communities that you serve and building a two-way interaction between you and other organizations who may be a part of the network already. We do have social media for you all to follow us on and engage with us in conversations online. And if you have any further questions, you can feel free to email myself or Dr. Danielle Baker, who's the Director of Community Engagement. And lastly, I'll just conclude that, again, this work was supported in whole by a $40 million award from the United States Department of Human and Health Services, specifically their Office of Minority Health. Thank you.
Fantastic. Brittany, thank you so very much. We are delighted to be on this journey with you. You all are certainly making a difference. Please do put in the chat a link to how other organizations can get involved or connect back to the NCRN. We will now hear from Dr. Oswaldo Ozzy Granado from Centura. He's a practicing physician and Chief Diversity Officer for Centura Health. Dr. Granado, please share with us information we need to know.
All right. Well, thank you so much, Rosalind. That was fantastic from Morehouse. I had no clue. So I'm very excited about that we are part of Carmen Spirit, Centura Health, and then hopefully working with you in conjunction with that, Brittany, because those are wonderful resources. So again, I'm from Centura Health. Centura Health, just a little brief background. We have two sponsors, Common Spirit and Advent Health. And so we have 21,000 mission-centered professionals who are guided by our mission to extend the healing ministry of Christ by caring for those who are ill, and by nurturing the health of the people in our communities. We're actually celebrating our 25th anniversary this year. We've got 17 hospitals, 14 affiliate hospital locations, neighborhood health centers, health at home, urgent care centers, emergency rooms, mountain clinics, and really over 100 plus physician practices and clinics, as well as Fight for Life Colorado. And we serve really over 500,000 people each year. So we're the largest provider of healthcare in Colorado, and we also have hospitals in Western Kansas. For us at Centura Health, we are really in the infancy of our journey on health equity. So we created a social justice framework after George Floyd's murder last summer that really put us in a position to say, how should we be responding? We have not really focused or looked at health equity in a way that was going to be meaningful. And in looking at how we would work with our associates and our communities, we wanted to make sure that this framework was very responsive, both internally and externally, to make sure that we were honoring the tenets of really what and who we are. Because we're a Christian organization, we really believe in some of our guiding principles, which allowed us to then couch the work we were doing in a way that really connected the social justice framework to our mission. All people are made in the image of God and are children of God. So all people possess an equal and inalienable worth, belong to a single interconnected human family. We look at the reality through the eyes of those who have been impacted by oppression and injustice. We join together in community, and we care for and nurture all creation, as well as actively participate in our communities. Well said, but we needed to do something about it. And part of that framework was then, what do? We have a big piece on really health disparities and looking at what can we do to impact health disparities that we see in our communities that we can actually affect. Around the end of December, we decided to look at how are we doing with associates, and associates are our workers, and how are they getting the vaccine by race and ethnicity. We saw that in December, late December, that we were not doing as well as we could have with our Black and Brown populations. So for our Black population of associates, we were down probably 40% compared to white associates, versus Latinx, they were down probably 22% to white associates in how often they were getting the COVID vaccine. So in a healthcare organization where we sent out a blanket email to everyone, had everyone have the same access, there were differences in who were actually getting the vaccine. And so we had to then start investigating why. Differences make a difference. So when we are looking at how do we, it's fine to send out a blank email or an email to everyone, but when you do things one size fits all, that typically benefits white populations. And so our white populations, our white Caucasian associates, they were getting the vaccine. We knew that we had higher rates of people of color in areas of the company that didn't have necessarily that same access or weren't on their computers all the time and looking at their emails. So there were several interventions that we've done now knowing that this was one of our big issues and seeing the data that we needed to focus on, and our rates have greatly improved since then. But the problem was we didn't lead with equity. Dr. Terry Richardson, I stole that from her, so I can't take credit, but wonderful concept, lead with equity. It's not rocket science. The state here in Colorado has not led with equity when we're looking at the COVID vaccines. If they had, we would have been prioritized as BIPOC communities, knowing the impact via health and economic outcomes that we've had. So because that hasn't happened, there's been delays in how do we get those vaccines to our communities of color. Again, the message went out, or the vaccines actually went out, and the message went out to our bigger systems. Here's the vaccine, get everyone vaccinated. Then two months later, we start seeing news and data come out that yes, we're not actually getting the vaccine to the people who need it. So that's been a big issue, is not leading with equity, because then we obviously then are left behind, and we continue to be left behind in the pandemic. And so we then try to catch up. We have an urgency with this. We know that life expectancy for Black men and Black men calculated after the end of the middle of 2020 went down by 3 years. For Black women, it was 2 years, down 2 years. And for everyone else, it was less than a year. So that incredible urgency that we are losing years of life off our whole population is terrible. And by not leading with equity, we then further put ourselves behind where we're having to catch up. So for us, we need to make sure that we're doing the things as a system to start to address these. Part of that is relationships. With the relationships that Centura has built, some of them are great in certain areas and lacking in others. For instance, we have a woman who's doing wonderful work with the promotoras in Denver. And so she said, look, if we can get the promotoras from the Latinx community to get information on the vaccine, as well then as get vaccinated in one fell swoop and alleviate their fears, address their needs in the language that they speak with people who are brown, who are Latinx doing all this work, then hopefully they'll be able to have a good experience and then go out and talk to others about getting the vaccine. It went incredibly well. So well that we then have now immunized over 100 promotoras who are now working in communities to then funnel people back to Catholic churches where they will have dedicated vaccine clinics for these communities of color, for that Latinx group. So wonderful example of reaching out, not just sending an email out, but reaching out, going deep with the relationship, going above and beyond to really capture this audience and looking at those trusted community leaders to then filter the information out to others. That's what we need in all of our communities. We did something similar with the mass vaccination clinic down in Colorado Springs, had a really good tie with one of the Black churches, worked closely with them, and had a really nice success rate with getting them into our mass vaccination effort. But do we have that everywhere? No. And as we continue on this process, if we don't have those relationships, we need to start building them. And in building them, we can't just come out and say, hey, we're going to give you all the vaccine, or we're going to do X, Y, and Z for you if they've never heard from us and we haven't worked together. I'm on the board for the Center for African American Health, and Deidre was approached by a really respected community health provider who said, look, we really want to sign people up to be trial participants, Black people to be trial participants for the COVID vaccines late summer. And in doing so, they said, look, we got to do this fast. Can you help us? Can you promote this? And Deidre was wise and said, no, you know what? We are not going to know, or we're not going to promote this in an expeditious fashion so fast without knowing so many different things about what's going on with the vaccine, with the trials, what's going on with the participants. And as a trusted community provider, put that out there when you are just coming to us through an email. So she shot that down pretty quick, but it was a good example of people can't go into communities that they're not a part of and expect a wonderful response, even with the best of intentions. It's got to be developed over time. And so as we continue to work with our populations, we know in certain areas we don't have hospitals where there is a high percentage of Black people or Latinos. But where we do have them, we have better opportunities to shape those partnerships. Where we don't, we're developing them such that we are working with those trusted community providers and leaders to say, hey, we have some resources. Would you be interested in them? Here's how we can go about this process. Learning from the past mistakes of others and how they've handled really developing those relationships it's really important to us so that we can develop longer term relationships so they can get the best information, our communities of color, to make an informed decision on getting the COVID vaccine and or other resources around COVID to then hopefully improve our communities of color in terms of our vaccination rates. So as we continue to work on a variety of initiatives, that'll be at the forefront of our minds. And I'm excited about the partnerships that we've created.
Fantastic. Thank you so very much, Dr. Bernardo, for all that you do. Our community organizations are many times the glue that holds us as community together. They give voice to our needs, hold us accountable, and make real who we are through their visibility, presence, and actions. The members of the Links Incorporated are committed to investing in Black-led and Black-serving organizations, and the Denver chapter of the Links Incorporated has deep roots in the Denver community, which date back to 1952. The Denver chapter, as part of the Links Incorporated, is one of the nation's largest and oldest volunteer service organization that serves African Americans and other persons of African ancestry. Nationally, the Links Incorporated has 290 chapters totaling 16,000 members. Locally here in Denver, there are more than 60 active and alumni members who give their time, talent, and treasure throughout the year. Personally, I'm proud to say that I am a Denver, Colorado chapter member of the Links Incorporated. And here today is the chair of the Health and Human Services facet of the Denver, Colorado chapter, the Links Incorporated, the Dr. Brandy Freeman. She's a practicing pediatrician and affiliated with Children's Hospital. Brandy, please share with us information we need to know about COVID-19 and community partnerships. Brandy?
Yes. Thank you so much for having me. It's truly a pleasure to be here representing the Denver chapter of the Links Incorporated. Thank you so much for sharing that little bit about what the Links is really about. We work in many different areas. Our facets are focused on national trends, international trends, services to youth, the arts, and then health and human services, which I am happy to serve as the co-chair for our Denver chapter. Specifically, the Denver chapter of Links overall has contributed over $1 million to support local, national, and international organizations that educate and enrich the lives of others. Our notable contributions have included over $250,000 in scholarships for our local high school students, a gift of $50,000 to help establish the Blair Caldwell African American Research Library, and most recently, we've been working to support the Center for African American Health. To learn more about our organization, I encourage you to visit our website, denverlinks.org, or follow us on Facebook. But now I'm going to spend time actually answering your question. So through this pandemic, our chapter has been focused on what I think is a great example of what a committed group of Black women can do, #BlackGirlMagic, but really how partnerships can have a significant and appreciable impact on our community and this virus. During this pandemic, the Denver chapter has been focused on making sure our community has the support that it needs. So just a few examples. So we adopted families over the holidays, making sure that all of their holiday needs were met and their wants as well. We did contributions to the Daddy Bruce holiday campaign drive. We've actually financially supported other organizations, including the Center for African American Health, the Mount Bello Organizing Committee, and the Center for Trauma and Resilience. We've been supporting reading for children at the Hallett Fundamental Academy through book delivery. And this was actually a conversion of a project that we did in person in pre-COVID times, but was really trying to make sure that the children had the books that they needed to continue their learning. And then we've been supporting social connectedness for our members and for our community overall. We've also been working on vaccine hesitancy as a part of this fight against COVID-19. And this has been done through chapter member education. Most recently, we had a seminar actually featuring Dr. Granardo. So really focusing on the importance of partnership here that you're seeing in this panel. And this was entitled, Getting to the Heart of the Matter, Understanding COVID-19. We've also done individual members who've been completing advocacy through social media, actually delivering vaccines in the community, and then individual advocacy. Recently, a story was shared with me from a member of our community who had not planned to get the COVID-19 vaccine, but then reconsidered this after talking with a member of our chapter. Additionally, the chapter has been focused and has been very fortunate to recently receive grant supporting to continue supporting the volunteerism and programs related to aligning our efforts on our theme of mental health this year. So we created a salon series that is focused on amplifying the importance of mental health and well-being with a special emphasis on the needs of the African American community. This educational series is going to include 5 individual highly curated sessions led by subject matter experts, community stakeholders, and industry innovators. The first actually occurred a couple of weeks ago, and was sponsored by the National Trends and Services facet of the Denver chapter and featured Dr. Ann Garrett Mills, who's the Chief Medical Officer at Aurora Mental Health, and then Dr. Pranita Ware of the Culture, Equity, and Leadership team for Denver Public Schools. That program was entitled Navigating Life's Journey with Resilience and Self-Care. Our International Trends and Services facet will be moving forward with a project on March 27th, so see the Denver Links website for more information about that. But that program is going to be entitled Remote But Not Alone, supporting families and building work and learning during this remote period. Additionally, programs this year are going to focus on our community in terms of the social and emotional areas that young children have during this remote period of learning. And this is to be done by making sure that reading literacy and building that access to books through additional programs that are going to feature books on featuring African American stories, characters, and addressing the topics of mindfulness, pride, self-esteem, and healthy habits. We plan on working with several schools on the Denver community about this. We're going to be doing programming for older adults that have been shut in for long periods of time during this pandemic, and of course has had a tremendous impact on their social connectedness and overall mental health. The Denver Links will support this and support several senior housing locations with a Links letter outreach campaign. And lastly, the Denver Links is focused on making sure that our community has access to credible information related to mental health, wellness, and self-care that is truly critical for our community. And we're going to be building a resource page on our website for this purpose. So collectively, the Denver Links has been focused on serving our community to the best of our ability through this time, and look forward to continued partnerships with all of the organizations on this panel in order to make sure that we not only survive, but thrive during this time. Thank you.
Brandy, thank you so much. And we're grateful for the work that the Denver, Colorado chapter of the Links Incorporated does for our city. You know, over the last 10 years while living in Denver, Colorado, one aspect of community that forever will represent for me the love, care, compassion, spirituality, and soul of the city has been our community of faith, specifically how we come together. Historically, churches have been a place of truth, power, influence, and affluence. And I got to tell you, Shorter Community AM in Church has been an important lens of truth for me, no matter in good times and bad times, whether it's on the radio, on the news. I know where Shorter stands on important issues impacting our city and communities of color. And with that, it gives me great pleasure and anticipation that I invite Reverend Dr. Timothy Tyler to speak with us, share with us information we need to know about COVID and our community of color, what they're doing, the access that they're creating. Please just share with us how important community partnerships are. Reverend Dr. Tyler.
Thank you. It is an absolute pleasure to be on this panel. I don't know if I can stand up to all of the giants on this panel, but I'm grateful for the opportunity. Shorter Community AME Church has been participating as a vaccine clinic. Dr. Brandy and others have helped us through UC Health, and we are excited. We confirmed with them that every 3 weeks we will be open to be a vaccine clinic. And all of this means a lot to me and a lot to us. Our church has physically been closed for, as of March 18th, we will have not had in-person service for 1 year. And it has been an interesting year. In this year, I have officiated over 10 to 11 funerals that were COVID-19 related in terms of my congregation. And also many of our congregants have suffered, and thank God have gotten well over the process with COVID-19. So it really, it's personal for Shorter Community AME Church. And not only for that, but we want to encourage all churches to get involved in this fight against COVID-19. And I have to be honest, since we've started this vaccine clinic, I'm not sure if the people have been excited about getting the vaccine or the fact that most of us are seeing each other for the first time after a year. And so what we're learning through this process and what we're encouraging other, especially Black churches of color, what we're experiencing is that through this pandemic, we have learned how to go from just going to church to actually being the church. And so though we're not able to gather for worship, now we're able to open up the doors of the church to help heal the community. There's been a lot of conversation going on about hesitancy. And I'm kind of in the camp that says, yes, there is some hesitancy, but for us right now, as Black people and people of color and indigenous people, it is not a problem of hesitancy as much as it is a problem of access. When I arrived at the church 12 years ago, I made a rule that I would never answer the phone, that my people had to answer the phone, and then they had to screen the call before it got to the pastor. I know that sounds kind of harsh, but you would be surprised to know the kind of phone calls that I have gotten in 12 years. But I decided that through this, most of my staff is working from home. I decided I wanted to answer the phone because I wanted to hear, we have been getting, we are Shorter Community AME Church, Dr. Freeman Health Organization now. We get calls every day. We hear y'all giving vaccines. And so I've been answering the phone just to hear what people are saying. And it's interesting, the calls that I have fielded in terms of whether they were my members or just community members, and they want to get it. They just want to be convinced that they should get it. There was one lady that called and she said, well, you think I should get it? Now, I'm very careful about telling people to get it because if they fall out, doctor, I don't want to get sued. But when she said, well, how do you know? I said, how do you know what? She said, well, how do you know that they're giving us the same vaccine that they're giving to the white people? She said, how do you know they're not exchanging now, truthfully, I really didn't have any evidence to shower down on her. But what I do understand is she'll call a second time and she'll call a third time. And once she has confidence that the pastor and the church are telling her the truth, she'll come in to get the vaccine. And so the church becomes a very important part of not only being open. It wouldn't be enough if we just open, but provide access. Some of our older members who couldn't get to the church, don't have transportation, we make it our responsibility to send somebody over there to pick them up, to bring them to the clinic. So it's also providing access and education. In our history, in the AME church history, back in the 1700s, the yellow fever hit Philadelphia, Pennsylvania, where the AME church was started. And our founder, Richard Allen, and get this, remember at the beginning of the crisis, the COVID-19 crisis, they said that Black people weren't getting it like white people were getting it. Back in the 1700s, there was this myth that Black people couldn't get the yellow fever. And so Richard Allen gathered the members of Mother Bethel AME Church and some Blacks in the community to go to the houses and to care for the people who were coming down with yellow fever. So I say that to say that it's in our history that the church, the Black church, has always been on the forefront of making sure that the community was cared for and cared for to life. And so it's just in our DNA. When I got to Shorter Community AME Church, they would read the history and they would read it so nicely. You know, Shorter used to be a silk stocking church. We shout a little. I can't wait to get back to church. I miss choir and I miss shouting. And when I was younger, I used to run around the sanctuary, but I don't do that anymore. When Shorter was founded, I found a history, and it said that there were two women who started the church. They were both named Mary, and Mary went to a bar and a casino, and they asked the gamblers and the alcoholics to give them money to start a church. So whenever I get in the pulpit, I tell the people that we were born of alcoholics and gamblers. We were started by the community, and so we owe it to the community to give back to the community, because if the community had not been around in whatever form it was, we would not be here today. And so this becomes very, very, very important. And I keep stressing it, that we've got to do all that we can in our power to make this accessible. I read in the Christian scriptures where it said, Jesus said, "I've come that you might have life." And then he doesn't just stop there, but he says, "And I've come that you might have it more abundantly." We have historically been a people who have been at the bottom of the list when it comes to health and life. And the pandemic has really put a spotlight on how systemic racism has destroyed and killed our people. And so now we have an opportunity not only to live, because we understand it better. I hope we're seeing it better, but we have an opportunity to live more abundantly. And so, there ought to be as many ways as possible to make sure that communities of color and Black people have access to this vaccine. I have a good friend, his name is Matthew Watley, and he's been in this fight on the East Coast, Reverend Matthew Watley. And he says, in terms of this hesitancy and how people are suspicious that Black people somehow will grow 2 heads and 5 arms if we get this vaccine. And I often ask people, have they done research into those hot dogs that they eat every week? But my friend Matthew Watley says that if it was going to be a conspiracy, then it seems to him the conspiracy would be that when they come up with this vaccine, only the white people would have access to it, and they wouldn't try to give it to the Black people, and then Black people would die, or people of color would die. And so I don't think there's a conspiracy, but I think that we're going to have to help those in the system to understand that we need access and we don't have access. My mother lives in Fairburn, Georgia. It is, can I say this? It is blackety black, black, black in Atlanta. I know I'm a Morris Brown College graduate and ITC. And my mother she's been trying to get on lists. She's put her name on 10 lists. She's 83 years old and not in the best of health. And she has been trying to get on lists for at least the last 2 months to get the vaccine. She just got her first shot today, and she had to go down to the Mercedes-Benz arena with thousands of people, and it's hard for 83-year-old older adults to maneuver an arena where 10,000 people. And so it should not be that way. And so we've got to address the hesitancy, but we've also got to address the access. And I believe that churches, communities of faith, faith houses, clergy persons, people of faith leaders have to lead the fight. The people, I'm grateful to God that as much controversy that the Black church has had over the years, basically the people still trust their faith house and they still trust their faith leaders. And so this is the moment when faith leaders are going to have to live up to that trust and help the people to live, and not just live, but to live more abundantly. And I'm just glad I feel privileged. I feel privileged and thankful to be in that fight because I just don't have it in me to do 10 more funerals because people died needlessly.
Thank you so very, very much. And I got to tell you, you picking up that phone, what access is that?
Well, I'm gonna tell you, people have been fainting when the pastor picks up the church phone because it ain't never happened before.
Yes, that's powerful. But there is an abundance of access that you're creating in a number of ways. I saw you and your wife getting your vaccination, and for them to see you doing it, taking that first step, said, well, if he can do it, I can too. Yeah. And we're going to follow the leader on that. And again, I thank you. I thank all of our panelists today. And we have Deidre Johnson, our CEO, President CEO of the Center for African American Health, who we would love to hear from as we close out our session.
Thank you so much. I'm excited to learn about the resources at Morehouse. So we'll be getting in touch next week to become a partner of the network. And just want to echo what everyone has said. This whole concern about hesitancy is only made worse when there is an access problem. That's exactly what we're seeing. So if we can continue to shout loud to get that attention, to make sure our communities are taken care of. And I appreciate what Dr. Granardo shared, because it's how you approach people. So when I got a phone call that day saying, send us Black people, I was like, no, because I know if you can't see us, it's harder for me to hear you. I need to know that our best interests are in being considered. And even my mother's a nurse. I went through my own research process because I wasn't going to tell community, get this done unless I was ready to. And so I'm just excited to be able to link arms with all of our partners and just provide as much information as possible, which is what the purpose of this summit was as well. And I just want to thank each and every one of you. And thank you, Rosalind, for your continued partnership and support over these many years.
Oh, you're more than welcome. As I said earlier, Common Spirit Health is committed to our communities of color. So again, thank you, everyone. Enjoy your weekend. Fabulous success to the Center for African American Health. Thanks for all that you do.
Thank you.
Thank you.